You know, I had a patient come in last week. Her name was Barbara, 71 years old, retired teacher. She brought a shopping bag, one of those reusable ones from the grocery store, and she dumped it on my desk. Bottles. Must have been 14, 15 different bottles. Vitamins, minerals, herbal extracts, things I'd never even heard of. And she looked at me and said, "Dr. Martin, am I doing this right?" I sat there for a moment, because, honestly, I didn't know where to begin. Thank you for being here. I'm a physician who's spent most of my career working with adults in the second half of life, listening to their concerns, learning what actually matters as the body changes. This channel is about honest, practical conversations. No hype. Just what I wish more people understood about aging well. If you find these discussions helpful, a like or subscribe helps others find them too. But more importantly, I'm glad you're here. Let's get started. And that's what I want to talk about today, because Barbara is not unusual. She's actually quite typical. Many of you watching this probably have your own collection. Some of you take 3 or 4 things every morning. Some of you take 12. Some of you aren't sure why you started taking half of them. And here's the thing that rarely gets said out loud. Some of those supplements are probably helping you. Some are doing absolutely nothing. And some, quietly, without any obvious warning signs, might actually be causing harm. That's not meant to scare you. I've spent over 30 years treating adults your age, and I've learned that fear is a terrible motivator for health decisions. But so is blind trust. And unfortunately, the supplement industry doesn't give you much guidance. Labels are vague. Doses are often based on studies done in much younger people. And your own doctors, myself included, I'll admit we don't always take the time to walk through what you're taking and why. So let's do that now. Let's actually talk through the common complaints. I hear fatigue, joint pain, memory trouble, sleep problems, muscle weakness, digestion issues, and let's go through what supplements might genuinely help, which ones might be a waste of money, and which ones need more caution than you'd expect. This won't be a sales pitch. I'm not here to promote anything, and I'm certainly not going to tell you to throw everything away. What I want is for you to walk away with a clearer sense of how to think about supplements as you get older, because the rules really do change. Let me start with something foundational. Your body at 65 is not the same as your body at 35. I know that sounds obvious, but the implications for supplements are more serious than most people realize. Your kidneys don't filter as efficiently. Your liver metabolizes things a bit slower. Your stomach acid production has likely decreased, which affects how well you absorb certain nutrients. Your muscle mass is lower. Your fat percentage is higher, and fat-soluble vitamins behave differently in that context. You're also probably on at least 1 or 2 prescription medications, and each of those introduces the possibility of an interaction. What this means is that a supplement dose that's perfectly safe for a 40-year-old might accumulate in your system in ways that matter. I've seen this with vitamin D. I've seen it with iron. I've seen it with B6, which most people think is harmless. It's not always dramatic, but over months, sometimes years, problems can quietly build. So right from the start, the first principle I want you to hold on to is this: more is not better. In older adults, more is often worse. Modest doses, targeted use, regular reassessment, that's the approach that works. Let's talk about fatigue first, because it's the most common complaint I hear. People come in and say, "I just don't have the energy I used to." And that's true. Some decline in stamina is normal with age, but persistent, unexplained fatigue deserves attention. Now, many people reach for B12 supplements when they're tired, and sometimes that's exactly right. B12 deficiency is genuinely more common in older adults, partly because of reduced stomach acid, partly because of certain medications like metformin or long-term proton pump inhibitors. If you're low in B12, supplementation can make a real difference. But here's the thing you should actually check. A simple blood test can tell you if your levels are low. If they're normal, taking extra B12 won't give you more energy. It doesn't work like fuel. You can't just top off the tank. I had a patient, a man named Harold, 74, who'd been taking 5,000 micrograms of B12 daily for 3 years. His levels were sky high. He wasn't feeling any better. When we actually investigated his fatigue, it turned out he had mild sleep apnea that had never been diagnosed. The B12 wasn't doing a thing, but he kept taking it because someone at a health food store told him it was good for energy. That's not an attack on B12. It's a useful supplement when there's a real deficiency. But the point is, fatigue is a symptom with many causes: anemia, thyroid issues, depression, poor sleep, medication side effects, heart problems. Assuming it's a vitamin deficiency without checking is often a mistake. Iron is another one I need to mention. In younger women, iron supplementation makes a lot of sense because of menstruation. But in older adults, especially older men and postmenopausal women, iron supplementation is usually not necessary, and it can be actively harmful. Excess iron accumulates. It's been associated with increased oxidative stress, liver issues, and there's even some concern about cardiovascular risk. Unless you have a documented deficiency, please don't take iron supplements just because you're tired. That's one of the more common mistakes I see. Coenzyme Q10 is something I get asked about a lot, and this one is interesting. If you're on a statin medication for cholesterol, there's reasonable evidence that your CoQ10 levels may be reduced, and supplementation might help with muscle fatigue or weakness that some people experience on statins. The typical dose in studies is somewhere around 100 to 200 milligrams daily. It's generally well tolerated. But if you're not on a statin and you're not experiencing those particular symptoms, the evidence for CoQ10 boosting general energy is actually quite thin. It's not harmful, but it may not be doing much. Let's move to joint pain and stiffness, which is probably the second most common complaint in my practice. Glucosamine and chondroitin have been around for decades. They're often sold together, and the research on them is genuinely mixed. Some studies show modest benefit for knee osteoarthritis. We're talking a small reduction in pain, not a cure, not cartilage regeneration. Other studies show no benefit at all. The most honest summary I can give you is this: some people do feel better on them, and if you've been taking them for a few months and you notice an improvement, that's not nothing. But if you've been taking them for 6 months and nothing has changed, it's reasonable to stop and see if you notice a difference. The typical dose studied is 1,500 milligrams of glucosamine and 1,200 milligrams of chondroitin daily. That's usually split into 2 or 3 doses. One thing I'll caution, glucosamine can affect blood sugar in some people, so if you're diabetic, monitor carefully when you start. It's also derived from shellfish in most formulations, so allergies matter. Turmeric and curcumin have become enormously popular, and there is real anti-inflammatory science behind curcumin. The challenge is absorption. Curcumin on its own is very poorly absorbed. You'll see products that add piperine, which is black pepper extract, to enhance absorption. That does help. The doses used in studies are typically 500 to 1,000 milligrams of curcumin daily, sometimes higher. Some people report noticeable reduction in joint stiffness. But I'll be honest, I've also seen patients who took high-dose curcumin for months without any benefit. It's not a guarantee. One thing to watch: curcumin can interact with blood thinners. If you're on warfarin or even aspirin, talk to your doctor. It can increase bleeding risk. That's not a reason to avoid it entirely, but it needs to be monitored. Omega-3 fatty acids, fish oil, this is one I do recommend fairly often. The anti-inflammatory effects are modest but real. For joint pain, you typically need a higher dose than what's on most bottles. We're talking 2 to 3 grams of combined EPA and DHA daily. Not 2 grams of fish oil, 2 grams of the actual omega-3 content. Read the label carefully. Most capsules have maybe 300 milligrams of EPA and DHA combined, so you'd need quite a few. Some people do better with liquid forms. Omega-3 seconds are also generally good for cardiovascular health, which is a nice overlap. But again, they can thin the blood slightly. If you're already on blood thinners, or you're having surgery, this matters. Memory concerns. This is a sensitive area, I know. First, let me say something clearly. There is no supplement that has been proven to prevent or reverse dementia. That includes ginkgo biloba. That includes all the brain health formulas you see advertised. I've had patients spend significant money on products promising to restore cognitive function, and the evidence simply isn't there. Ginkgo was studied in large, well-designed trials. It did not prevent cognitive decline in older adults. It did not improve memory in people with mild impairment. That's not my opinion, that's what the research showed. Does that mean nothing helps? Not exactly, but the honest answer is that the most effective things for brain health are not supplements. They're physical exercise, social engagement, blood pressure control, blood sugar control, adequate sleep, and treatment of depression or anxiety. Those things have far more evidence behind them than any pill. That said, there are a few nuances. If you're deficient in B12 or folate, correcting that deficiency may help with cognitive symptoms. I've seen this, particularly in patients who were quite low. But again, this applies when there's an actual deficiency. Taking extra B vitamins when you're not deficient does not enhance memory. Omega-3 seconds may have a modest protective effect on brain health over the long term, though the evidence is not conclusive. I consider them reasonable for general health, but I don't prescribe them specifically for memory. There's some interest in phosphatidylserine, a compound found in cell membranes. Early studies were promising, but they used a form derived from cow brains, which is no longer available. The plant-derived versions sold today have less convincing evidence. I don't discourage patients from trying it, but I don't actively recommend it either. And then there's the whole category of nootropics, things like lion's mane mushroom, bacopa, various adaptogenic herbs. The research on these in older adults is very limited. Some small studies look interesting, but we don't have the kind of long-term data I'd need to confidently recommend them to my patients. If you're curious, start with a low dose, be patient, and be honest with yourself about whether you're noticing any real change. Sleep problems. I could talk about this for hours. Poor sleep is incredibly common in older adults, and it has serious consequences for memory, for mood, for immune function, for fall risk. But I also see a lot of patients reaching for supplements that either don't work or cause problems of their own. Melatonin is the big one, and let me be careful here, because melatonin is useful in certain situations. If you're dealing with jet lag, or if your sleep schedule has shifted significantly and you're trying to reset your circadian rhythm, melatonin can help. The effective dose is actually quite low, often 0.5 to 1 milligram, taken about an hour before your desired bedtime. What I see instead is people taking 5, 10, even 20 milligrams. And here's what happens. At those high doses, melatonin can cause next-day grogginess, vivid dreams, sometimes headaches. It can also interfere with blood pressure medications and may affect blood sugar. There's no good evidence that higher doses work better for sleep. More is not more. Another issue is that melatonin is not well regulated. Independent testing has shown that actual content varies wildly from what's on the label. Some products have had much more than stated, some much less. That's a quality control issue that most people don't think about. Valerian root is another common one. The research on valerian is inconsistent. Some people swear by it. The studies show modest effects at best, and sometimes no effect at all. It's generally safe, but it can cause headaches in some people, and it shouldn't be combined with sedative medications. Magnesium is worth mentioning. Many older adults are mildly deficient in magnesium, and there's some evidence that correcting this can help with sleep quality. Magnesium glycinate is often recommended because it's easier on the stomach. Doses around 200 to 400 milligrams in the evening are typical. Just be careful if you have kidney problems. Your kidneys regulate magnesium excretion, and high doses could be an issue. L-theanine, an amino acid found in tea, has some calming effects and is quite safe. It's not a strong sedative, but it may help take the edge off evening anxiety, which for some people is the real barrier to sleep. A typical dose is 100 to 200 milligrams, but here's my larger point about sleep. Supplements are secondary. If you're having chronic sleep problems, the most effective intervention is something called cognitive behavioral therapy for insomnia (CBTI). It's a structured approach to sleep habits and thought patterns. There are even good online programs now. It works better than any supplement, and the effects last longer. Muscle weakness and sarcopenia, the gradual loss of muscle mass with aging, is something I take very seriously. It affects balance, independence, metabolic health, and there's one supplement that actually has strong evidence here: vitamin D. Now, vitamin D is probably the most studied supplement in older adults, and the evidence is clear that low vitamin D is associated with muscle weakness, increased fall risk, and fractures. Supplementation, when you're deficient, can help. The tricky part is dosing. There's a lot of confusion about this. I generally aim for blood levels around 30 to 50 ng/ml. For most older adults who are low, that requires somewhere between 1,000 and 2,000 IU daily. Some people need more, especially if they're significantly deficient, obese, or have absorption issues. But I've also seen patients taking 10,000 IU daily for years without monitoring, and their levels are dangerously high. Vitamin D is fat-soluble. It accumulates. Toxicity is real, and it can cause kidney stones, hypercalcemia, and other problems. So, please, if you're taking vitamin D, get your levels checked at least once a year, and don't assume more is better. Protein is not exactly a supplement, but I mention it because many older adults don't get enough. The RDA for protein is probably too low for seniors trying to maintain muscle mass. I often recommend aiming for 1 to 1.2 grams per kilogram of body weight daily. If you struggle to get that from food, a protein powder, whey, or plant-based can help. Leucine-rich proteins are particularly good for muscle synthesis. Creatine is another one that's underappreciated in older adults. It's usually associated with young bodybuilders, but there's actually good research showing that creatine, combined with resistance exercise, can help preserve muscle mass and strength in seniors. The dose is about 3 to 5 grams daily. It's quite safe for most people, though if you have kidney disease, you should check with your doctor first. Digestion and constipation. This affects so many of my patients, and it's often undertreated. Fiber supplements, psyllium husk, methylcellulose can genuinely help, but you have to use them correctly. Start with a small dose and increase slowly. Drink plenty of water. If you just take fiber without adequate fluid, you can actually make constipation worse. Probiotics are popular, but the evidence is complicated. Different strains do different things. For general digestive health in older adults, there's some support for certain lactobacillus and bifidobacterium strains, but it's not a one-size-fits-all situation. I usually tell patients to try a product for a month or two and see if they notice improvement. If not, there's no reason to continue indefinitely. Digestive enzymes are sometimes helpful if you have specific issues, lactose intolerance, for example, or pancreatic insufficiency. But for general use, I don't see much benefit. The body makes its own enzymes, and unless there's a real deficiency, adding more doesn't do much. Magnesium, which I mentioned for sleep, can also help with constipation. Magnesium citrate in particular has a mild laxative effect, but be moderate too much can cause diarrhea, and again, kidney function matters. Now, let me step back for a moment, because I think the bigger issue is not which specific supplement to take, it's how we approach this whole category. I've been practicing medicine for a long time, and one of the most important things I've learned is that patients often use supplements to feel a sense of control, and I understand that. Medicine can feel disempowering. You go to a doctor, you get a prescription, you're told what to do. Supplements feel different. You're choosing. You're taking charge. But that sense of agency can become a trap if it leads to confusion, to spending money on things that don't help, or to quietly making your health worse. The best approach, in my experience, is to be strategic. Don't take a supplement because someone told you it was good for your age group. Take it because there's a specific reason for you, a documented deficiency, a symptom you're trying to address, a thoughtful discussion with your doctor, and review what you're taking at least once a year. I ask all my patients to bring in their supplements at annual visits. We go through them one by one. You'd be surprised how often people are taking things they don't remember starting, or things that made sense 5 years ago but don't anymore. I also want to mention drug interactions, because this is where real harm can happen. Vitamin K affects how warfarin works. If you're on warfarin and you suddenly start or stop eating a lot of leafy greens or taking a supplement with vitamin K, your blood clotting can change dramatically. I've seen bleeding events from this. I've seen clots. Street John's wort, which some people take for mild depression, is a nightmare for drug interactions. It induces liver enzymes that metabolize dozens of medications faster. Birth control, blood thinners, certain heart medications, even some cancer drugs. It's not a gentle herb, it's a serious pharmacological agent. Calcium supplements, taken at the same time as certain antibiotics or thyroid medication, can block absorption. Timing matters. Ginkgo, which I mentioned earlier, can increase bleeding risk. So can high-dose omega-3 seconds. Taken together with aspirin or other blood thinners, you can run into trouble. This isn't about being afraid. It's about being informed. If your doctor doesn't ask about supplements, bring it up yourself. Keep a list. Be specific about doses. So, where does this leave us? Here's what I would say to Barbara and to you. Supplements are tools. They're not magic. They're not a substitute for eating well, staying active, sleeping enough, managing stress, staying connected to people who matter to you. When used thoughtfully, for specific reasons, at appropriate doses, some of them can genuinely help. When used carelessly, they can confuse, waste money, and occasionally cause harm. The goal, as we get older, is not to live forever. That's not realistic. And honestly, I'm not sure it's even desirable. The goal is to function well, to stay independent, to feel reasonably good most days, to be able to do the things that matter to you. Supplements can play a small role in that, but they're never the whole story. If you're watching this and you're not sure about something you're taking, ask. Ask your doctor. Ask your pharmacist. Ask questions until you feel like you understand. You have that right. And you deserve clear answers, not vague reassurances. I'd love to hear from you, too. If you've had experiences, good or bad, with supplements as you've gotten older, share them in the comments. We learn from each other. That's how communities work. Thank you for listening. Take care of yourself.